Hello. I grew up in rural South Georgia, about 33 miles from the nearest hospital. Because of our distance away from good medical care, my parents became quite proficient in home remedies. Since I grew up with these, I know their effectiveness. I know that in many instances they are the best remedy for a certain disorder. It won't work for all things, but it does work for many, and where it is applicable, a home remedy is the best remedy that we have for that disease. We're going to be talking about home remedies, some of which I think you will never have seen before. So we hope you'll join us, and I know you'll enjoy the program.
The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented. Welcome to Help Yourself to Health with Dr. Agatha Thrash of UG Pines Institute. And now, here's your host, Dr. Thrash.
In most homes, you will find a lot of things that are very applicable to home remedies. Now, every home that has water and a source of heat and a source of cold and cloths and sometimes some kind of irrigation equipment, any home that has these can be sure that they know that they have the equipment to do the home remedies. Now I have here a very simple home remedy. This is a cough syrup. And notice this thick honey. See how thick it is? This honey is produced in South Georgia. It's gallberry honey. And as you can see, it is quite thick. But when you put that with some chopped onion, just ordinary onion chopped, notice how very thin the honey gets. The reason for that, after 12 hours or so, it has extracted all the benefits from the onion. Now we have their quercetin, we have a lot of flavonoids and a variety of antioxidants, some antimicrobial substances, a lot of things that can be most beneficial for a cough. And this is a cough medicine. Let me show you what you would do from this point. Just take a strainer and pour the material that you have, the juice, the onion honey, pour that into a strainer and strain out the onion. And then you have the onion honey fluid. You can mash this a bit to get it so that you have only the fluid in a cup, and then it can be stored in the refrigerator. Simply store the nice honey water. Now when a person has a cough, whether it's dry or productive, this can be used by the teaspoonful to quell the cough. Not very long ago, we had a patient who had a cough that was really terrible. And every time she coughed, she would take a teaspoonful of this from the refrigerator and simply swallow it. In seconds, her throat would feel better. She would have a paroxysm of coughing, and in just seconds, she would be free of cough and go sometimes for half an hour with no coughing. Then another paroxysm of coughing, just almost like the whooping cough. Take another teaspoonful, and it was again quelled in just a matter of seconds. Now, a close relative of onion is aloe. Aloe can grow in your kitchen or in your living room. It's a beautiful plant. You can have it if you live in very warm climates. You can have it living out of doors. And it has so many uses. And I have asked Rhonda Clark, who is one of our co-workers at UG Pines, to tell us some of the wonderful and unexpected uses of aloe vera.
Oh, there are so many. I really enjoyed researching a little bit of the unexpected uses of aloe vera. A typical bottle of aloe vera gel that you can find at a health food store, even now in many pharmacies or grocery stores, has so many uses for us you just wouldn't believe. Let's see if I can turn this around for you. There you go. And some of the ones that I knew of course, is that it's wonderful for burns. It's wonderful to put on poison ivy or insect bites or other irritations of the skin, such as a scrape or a small abrasion. But did you know that this also can be used as a deodorant? It can be used as a hair gel or a hair conditioner. And it even is a wonderful treatment for dandruff. If you just thickly apply aloe vera gel to the scalp, allow it to set for 10 minutes, and then shampoo the hair as normal, it can help clear up dandruff.
And you just sort of work it into the scalp?
Work it in good, let it sit, and then shampoo your hair as normal.
Oh, that sounds interesting.
Yes. You know, it was said that Cleopatra used aloe vera as her secret for beautiful skin. In ancient Egypt, they used aloes in the embalming process, not to help preserve anything, but just to help keep the skin intact. Aloe vera gel makes a wonderful face moisturizer, face cream, and it has a nice microbial killing property that makes it useful for individuals with acne, psoriasis, other types of skin conditions that you want to keep the skin very clear of bacteria.
You have anything for wrinkles?
No proof against wrinkles, unfortunately.
Well, I guess I'm proud of all my wrinkles. It indicates that I have lived a long time. That's amazing in this age.
Yes. There were some things that surprised me when I was reading this. I guess there are some individuals who suffer with odor in the belly button, of all places. And aloe vera is a wonderful remedy for that. Using aloe vera gel twice a day in the belly button can help reduce irritations or odor in the belly button. And some other kind of surprising things with aloe vera that I thought were oral care. This one really surprised me. There's a growing body of evidence of the benefits of aloe vera gel in many dental procedures. It can be used to treat gingivitis or inflammation of the gums, and that can be either by gargling, rinsing, swishing with an aloe vera juice, or letting the gel sit against the gums for a period of time. There's even now toothpaste made with aloe vera that can be useful in fighting against gingivitis. When a tooth has been extracted, aloe vera can help prevent infection in that socket of the extracted tooth. It can be
a nice, excuse me, go ahead.
Go ahead, I was just going to say.
A nice way to put it against the gum is to take a small segment of one of the blades of the aloe, remove the cortex or the little bark of it from one side and make sure there are no thorns projecting from it, and then lay that right against the gum. And in a few minutes it becomes quite nicely soft and molds to the side of the jaw, and that makes a very nice antimicrobial remedy for a gum boil or an abscessed tooth.
Yeah. Well, I appreciate the opportunity to come and share some of these unusual uses of aloe vera gel.
Well, thank you so much.
Sure.
I enjoyed these, and I'd like to try the one with the aloe vera shampoo.
Yes.
Thank you. Now, I would like to show you another remedy, and this remedy is a heating pad. It's a very simple one. You can just buy these from a pharmacy or a department store, and they should be in every home having electricity. If you don't have electricity, all is not lost. You can simply take a bottle of the appropriate size, fill it with hot water, wrap it with a towel, and it can be applied in the same way to the chest, to the abdomen, to the back, to a knee, a foot, and in any place where there is pain or discomfort. It can be nicely used to great advantage. It has both immediate benefits in pain relief, and it also has long-term benefits in healing. Now, I suppose my very favorite remedy is charcoal, and I have asked Cal Thrash to join me for this next demonstration, which will be of charcoal remedies.
Yes.
Cal, you have a number of things here I see, and I know that you're very familiar with charcoal because you grew up with it.
Certainly did. In fact, have some experiences that I'd like to tell today to our viewers as well. Charcoal is an absolutely amazing substance, but it doesn't look like a whole lot when you look at it. It's just a powder, and it's what, as you expect, a black substance. And of course, what we use is powdered activated charcoal, it is quite useful for many external applications and some internal ones as well.
Now, you said it was activated. Tell us what that means.
Activation is a process that the charcoal goes through when it's still in the kiln. The steam is injected into the environment under pressure, and at just the right temperature and the right pressure, it actually blows open more holes, a little surface area in the charcoal.
And these little surface areas are for what purpose?
That's to attract poisons to it. Now, I have a graphic that perhaps we could show at this time that has actually a picture that the tunneling electron microscope took of charcoal surface, and you can see the surface of the carbon there under extreme magnification, of course, and see the features that charcoal has to it.
There's little ridges and holes and valleys.
Right.
Yeah,
Right.
and I guess the toxins go in all of those little valleys and into those holes and are held there.
That's part of the beauty of charcoal, actually. In fact, one of the uses of charcoal is to take up and draw poisons of all types. Drugs fit into that category as well, so they can be taken up, but toxins
from germs.
That's true, and in fact, even bacteria themselves can be actually taken up by charcoal. Some people think, though, that once the charcoal has actually soaked up, if you want to call it, these toxins and poisons, that it could be squeezed back out again. But that's not really what happens with charcoal. Charcoal works through the process of what we call adsorption. You notice I said adsorption and not absorption, which is different. It's actually the attachment of the toxin to the surface of the carbon itself.
So it comes into the charcoal by a method of attraction.
That's correct.
Rather than just being absorbed where it's just like a sponge, it flows into it.
That's right. Now, the process of taking the poison back out of the charcoal is considerably more difficult and usually not compatible with life, although it's true that under certain circumstances some of the toxins could come out. But those are very unusual circumstances. For instance, if a person has been given a drug like morphine or something that actually stops the bowel itself, then the person may have trouble actually eliminating that charcoal, and it could cause problems. But most people don't have that kind of a problem, and if they're generally healthy, then they won't have a problem with eliminating the charcoal and the toxin that it took up.
Now, you look as if you're going to make a charcoal compress.
Actually, I'm going to show some of the uses for external uses of charcoal. And I have some of the sizes. I'll show you some of the sizes of the charcoal that we actually carry at our bookstore at Uchee Pines. And we bottle this up ourselves. Now, this one is the largest size that we have. It's a 2.5-pound size. And it's the easiest probably to use under most circumstances for external uses where you need a lot of powder.
Such as, let's say, a brown recluse spider bite.
That's correct.
It takes up that toxin right through the skin.
And we'll be talking about some of those uses, too, as we go along here. I won't be able to show you probably that one because that would be quite an intense usage of charcoal. But this smaller size is probably the most common size. That's the quart size charcoal, and we have that as well. These are powders, and it's powdered activated charcoal. And then we have smaller sizes. This one is a tablet and a capsule, veggie caps, both of which we have at our store there at Uchee Pines, and we bottle all of those together there at Uchee Pines. But
now, would you use charcoal capsules for its external use, say making a compress?
You could, of course. It's considerably more expensive to do it that way. Probably the best way to use charcoal, the most effective way, the most cost-effective way, is to use it as the powder. You can use it both internally and externally.
So if you're traveling, you'd certainly want to take the powder.
Probably want to take some along. Now, I think it's entirely possible that you'd want to have capsules and tabs when you go traveling. And in my experience, actually, it seems like the most common thing that happens to you when you're traveling is some kind of gastrointestinal distress.
Yes.
And
what can be called Montezuma's revenge if you're
true.
going south of the border.
Now, I have to say that charcoal is very effective with these types of gastrointestinal problems. And I wouldn't travel without it.
I never travel without it. It will save your trip sometimes.
Absolutely. Now, what I'd like to demonstrate today is a poultice, and for that,
Good.
I'd like to ask Ariana Hartsfield if she'd come.
Good.
And we will show you actually the external uses here in a kind of a small way, because obviously it would be very difficult to work with charcoal in a large way here at this set. I want to show you exactly what I mean by that. When I add the water to the charcoal, you can immediately see...
Let me hold you here. Let me help.
Very good, very
Hold
good.
that.
Now you can immediately see that charcoal will begin to powder out, and it's very light. Now people have...
I see this little dust coming up there.
And you don't want to stir very rapidly. Now, people have told me that they have tried to mix charcoal in various ways. They've stirred it very quickly and tried to get it mixed up quickly, but this is not a quick process at all. You want to really take your time when you're adding the water and mixing the charcoal. One person told me they had a neat experience. They put this into the blender and put some water in there and turned it on, and even after they opened up the top, it was pretty much everywhere all over the kitchen. And so it's something that you want to go very carefully and very slowly with. And the mixing process can take a little bit of time, so don't rush this process at all. But I have mixed some up already for you, and you can see from this little container here about the consistency that I've mixed it up is the consistency of probably soft melted ice cream here. And it does taste wonderful just like that ice cream would. But this is probably just a little bit thick for the average poultice. It's not too bad, but you certainly don't want to scrimp too much on the water when you're using it, because you do want it to go ahead and soak through the material that you're going to put it on. And of course, this today we are going to use a paper towel, which is very easy to use for the poultice. So we're just going to spoon this onto the paper towel material itself, and it will begin to come through the paper towel as you spoon it on. And of course, you can make it fairly large, whatever the size is you need to be able to take up the surface of the problem that you have. And we'll just assume that Ariana has a bug bite, that she is having some maybe a little inflammation, maybe a little bit of infection there.
There
and
it
we
is,
want
right
to try to take all of this up with the charcoal. So we're going to put that right onto the surface of the area and cover it well, so that you make sure you have plenty of area covered with the charcoal. Don't scrimp in this area. This is not where you want to scrimp at all. You want to make sure you cover plenty of area with that charcoal poultice. And then we take some plastic wrap. The regular good stretchy kind is good. And we can cover our charcoal poultice with our stretch wrap. And of course, this is probably way too much for the average poultice, but it's to show you exactly what you'd want to do. You probably could use less, just enough to cover the charcoal poultice itself. Then you could take some tape. The best thing actually is to take some paper tape, the kind of surgical tape that you find, and actually tape the edges around like this. And of course, that keeps the charcoal from coming out the side, and it makes it so that the person can wear this for quite some time, maybe several hours, without having any problem at all with the charcoal leaking out around the edge.
Maybe even wear it overnight?
Certainly could be worn overnight
for a couple
if
of
necessary.
days if necessary.
But depending on what it is, this poultice could be used for an hour or two, or up to probably 12 or so hours. But you wouldn't want to keep it on for too terribly long, because it could begin to cause a little bit of a problem being wet there. Once the charcoal has, pretty much all the surface area has been used, then it's taken up whatever it needs to. You need to go ahead and take that one off. And if the problem still exists, then you want to do that all over again. Start it with another charcoal poultice and continue to do it. Now, we talked about brown recluse spider bites. Brown recluse spider bites are quite a problem in that they can actually cause necrosis or death of the tissue all the way down to the bone in a cone-shaped area. And there is no real effective way to treat brown recluse spider bites except for using charcoal. They use steroids and just excision of the tissue and so forth. But it can cause a real problem and continue to cause problems on through until the person gets skin grafts, which sometimes will take, and sometimes because of the inflammation that's involved in this, they can slough off and cause a problem and be a real tough issue. In fact, it can even cause amputation of certain limbs because of the brown recluse bite. This treatment that we've just shown you, of course, a considerably bigger area that you want to make your charcoal poultice, and you can use a cotton, a piece of sheet or something that you could put it on rather than a paper towel. If you'd like to use it over, it's something that you can do. But certainly with a brown recluse bite, you want to change that poultice probably once every couple of hours at the very most, maybe even more often than that, to give the opportunity for the charcoal to take up as much of this poison as possible and take it away so that it is not something that the body has to deal with, and the body can focus on healing the brown recluse bite rather than...
I remember a patient that you had one time who had a brown recluse spider bite on the leg, and it was a week or so before the patient came for the poultice, and yet it was healed, but it took quite a while. It took, what was it, 5, 6 weeks?
It took well over a month. In fact, I think that it was more like about 3 months that the person was dealing with this problem. So the faster that you can actually get the poultice, the charcoal, to the site of the bite, the better. And that, of course, includes bee stings or anything else that a person is having any kind of a reaction to.
Very good. How about a snake bite? Would you use it for a snake bite?
I wouldn't hesitate to use it for a snake bite. I have never had the opportunity to actually do that, and so I'm not really certain the procedure other than just simply using as much charcoal as is possible, and I think I would also use it internally as well as externally in that type of instance.
Yes, I'm sure I would too, but I still think that the antivenin might be a good route to go. Maybe using both, the charcoal for the first aid and the antivenin at a later time.
That's correct. Now, we had one other graphic that we wanted to show you, and that's a picture of a young fellow that's in a bathtub that has charcoal in it. Now, what was happening here was that the individual involved had the chicken pox, and you just draw a bath full of water and put some charcoal in it. Now, you don't have to necessarily put a certain amount, but a cup or two in the bath. Helps to bring about the relief from the itching, and the little boy there was saying, it doesn't itch anymore after only a minute of being in the charcoal bath.
It certainly looks messy.
It is quite messy, and it's not something you'd want to do every single day, but I can tell you this, that if a person did have snake bite or something that was a serious problem, I certainly wouldn't hesitate to put their whole affected area, if it was their arm or their leg. Usually, most of these snake bites are around the leg area where the snake has actually gotten the person as they walk along. I wouldn't hesitate to put that whole limb right into a bucket, or even put them in the bathtub full of charcoal, because that certainly would give the opportunity for as much skin area as possible to take that toxin right out of the body.
Now, I know of 3 instances where really serious snake bites have been treated with charcoal in field situations. And so I wouldn't hesitate to do it and to rely on it in a field situation. But
I wouldn't either.
If I had the antivenin, I think I'd probably not have the courage to just use the charcoal alone.
I'm not sure I would either, but certainly it has been used effectively in stories that I've heard, especially with animals, where an animal was treated that way and seemed to be just fine the next day. So I'm not sure that it's not effective, but like you, I'm not certain that I would just rely only on that one.
Well, thank you so much. I appreciate this very nice
You're welcome.
Discussion of charcoal. Now, there are so many other remedies that you can use, and maybe I will ask Dr. Don Miller to come next and show you some remedies. And what have you here, Dr. Miller? You always have nice things that you talk about.
Well, I travel around a lot, but I was just thinking as I was listening to Rhonda and Cal's presentation, Cleopatra used aloe vera for her youth, and she needed some of Cal's charcoal for her asp bite there at the end.
Oh, that's right. That would have been history would have been changed.
Maybe. I travel a lot, and here are some charcoal tablets I bought in Ukraine.
Oh, yes. Okay, I feel them in there.
Wherever you go, it's amazing how other countries have a lot more of the very simple remedies. And charcoal is very easy to find in other, especially in Eastern Europe and other countries. But what I wanted to show you was my little travel kit.
Oh, yes.
I basically have a mind towards travel because when we travel, we have to have it. And that's why these come in so handy. It's hard to mix a charcoal poultice or a charcoal slurry when you're
up in the air.
36,000 feet and making a mess all over the place. And so a few tablets in the mouth chewed up. And you have to, I like to chew them up because the more you break them down, the more they get to work.
And then if you've got anything in the mouth, it helps with that. So
Absolutely.
from bad breath to
Absolutely.
gum boils.
May sort of freak the stewardess out when she sees all the black in your teeth. But
It's good
then
also for a sore throat.
it's good for whitening the teeth if you get it off the teeth, which you do with the toothbrush.
Yes.
My goal when I travel is not to get sick in the first place.
Oh, yes.
Now, charcoal's great to sit there and take care of that Montezuma's revenge, but why not try to prevent Montezuma's revenge in the very first place? And having been in the Marine Corps for 14 years, maybe Montezuma's a little bit more aiming at me. So I carry little things called wet ones.
Oh, yes.
And there's various different types. This is a wet one.
One of the best ways to avoid a cold. Keep your hands clean.
Keep your hands
so when
clean.
you touch your eyes and your nose and your mouth, you won't be transferring germs.
These are some I bought in Ukraine, although they are in English. But I bought those in Ukraine, and I use this for many, many different things. If you're traveling and you're in a situation where you use the toilet and maybe the toilet paper is not adequate or whatever else, these are very nice, very soothing. Cleaning your hands after anything you do before you eat. Sometimes I even wipe my food down with it. I may catch a little bit of what is on the cloth. I'd rather have a little bit of that chemical than whatever that virus or bacteria or whatever else
Which
might have
kill
been.
you.
Might kill me. I carry, these are very nice. I took a bunch of these one time down to Africa for my students, and I kept one set for myself. This is a pair of tweezers with a magnifying glass attached to it.
Oh.
For when you get those splinters or other things that might be giving you a problem.
Thorns.
That way you can don't have to try to hold a magnifying glass with your teeth and whatever else. You've just got it all right there, and you can pick out your splinter or thorn or whatever else it might be, and maybe a whatever else it could be. Very nice with the magnifying glass, and so I like to carry a piece of equipment like that. When I'm traveling, you know, we talk about the loss of health, how important sleep is. And sometimes it's hard to get a good night's rest or a good flight rest. And so I like to carry with me some earplugs. Keep them around my neck. They're always there. I like these type because if one falls out, it's not going to fall on the floor and I can't find it. And so these are very nice mosquito protectors too. You can't hear the little fella.
Very good. Well, thank you, Dr. Miller.
Yes.
Appreciate your showing us your kit. And with these simple things, we hope that you will live much more successfully in this diseased world.